Ladies and gentlemen, please welcome to the stage Concordia co-founder and chairman of the board, Nicholas Logothetis, Dr. Mary Margaret Frank, academic director at the Darden Institute for Business and Society at the University of Virginia, and Keith Cratch, Undersecretary for Economic Growth, Energy, and the Environment at the U.S. Department of State.
Good morning, everyone. Welcome back to day 2 of Concordia from all of us. This is a session that we're extremely proud of and thrilled that you're here to join us for this morning. So Concordia, the U.S. Department of State's Office of Global Partnerships, and the University of Virginia's Darden School of Business Institute for Business and Society are once again humbled by all of the applicants of this year's P3 Impact Award, which recognizes leading public-private partnerships around the world. This award was born from aligned interests across all sectors, nonprofit, government, and business, and an ardent desire to better understand the growth of partnerships and the factors that influence success. Our mutual desire to understand the role of P3s in addressing complex global societal issues, highlight best practices and shared learnings, as well as honor organizations leading the way, has brought us here today, celebrating our 6th iteration of the P3 Impact Award. To date, we've received hundreds of applications from all over the world, leveraging partnerships to address challenges in their local communities and countries. Each year, our staff are blown away by the applications we receive. They represent partnerships that truly highlight cross-sector collaboration at its best, ones that improve communities in most impactful ways, fostering a more productive utilization of resources by respecting and leveraging differences.
Public and private sector collaboration, embodied by partnerships like the ones we are celebrating here today, facilitates innovation, impact on scale that can bring economic security, peace, and prosperity to all nations. From embracing market-based solutions in agriculture in order to elevate farmers from the poverty in Southeast Asia and Africa, to enhancing access to reliable, affordable, and effective health care in the Caribbean, this year's finalists are driving the solutions that will create a more secure and stable global ecosystem. By using collaborative models and leveraging the strengths of public, private, and civil society partners, the finalists are ensuring the impact they are having today will continue to be sustainable and scalable for the next generation of leaders and innovators. They highlight the value of trust, transparency, and accountability in facilitating cross-sector partnerships that develop and deliver global solutions to some of our toughest problems. These are truly outstanding examples of best practices for working together across sectors to achieve these goals. Congratulations to all the finalists here today, and thank you for your positive impact you have had around the world. Our 5 finalists are:
You go first.
I've got the first one, ladies and gentlemen. Get ready. Care 2 communities and the government of Haiti have come together to form the partnership to deliver quality, sustainable, primary health care in Haiti, which has adopted a market-based approach to improve access to and quality of community-based healthcare clinics across all of Haiti.
The value chain for rural development partnership between Winrock International, USAID, Amaria, the Coffee Quality Initiative, Coffee Atlas, and Behind the Leaf Coffee links ethnically diverse communities of small farm holders in Myanmar, to better paying domestic and global specialty coffee markets to improve agriculture productivity and incomes, spurring inclusive economic growth in a country once isolated from the world and the global marketplace.
All right, number 3. Numero 3. Conservemos de la Vida is a collaboration between the World Wildlife Fund, Fundación Grupo Argos Fundación, Smurfit, Kappa Colombia, National Central Parks of Colombia, Incorporación Autónoma Regional del Valle del Cauca, that has adopted a localized approach, working with rural farmers to protect the Andean brown bear from extinction.
Fourth, Bioko Island Malaria Elimination Program is a partnership that combines long-term financial commitments from Equatorial Guinea's Ministry of Health and Social Welfare with expert assistance from MCDI and IFACARA in the nonprofit community, corporate partners of Marathon Oil, Noble Energy, and Atlantic Methanol Production Company, Scenaria to represent the biomedical community, and Swiss TBH as part of the academic community. Talk about getting everybody. Together, they have developed a malaria elimination methodology that has not only reduced malaria prevalence by 75%, but has also created a model for malaria-affected regions across sub-Saharan Africa.
And finally, the Commodity Alliance Forum and Value Chain Development Program, with partners at IFAD and OLAM, address systematic market distortions in Nigeria to support smallholder rice farmers on the path to profitability and reliable livelihoods.
It has been another great year of applications and even stronger finalists. Each year, the P3 Impact Award process informs the partnering community about how different stakeholders are collectively working together through internal and external channels towards achieving an aligned goal. We, and I personally, learned so much through this process, and we use our work together strengthening the Parco ecosystem so that innovation across the world can be shared with like-minded stakeholders around the world. I want to extend my appreciation and congratulations to all of those who have helped us today. Please join me in thanking our esteemed panel of judges for the 2019 Impact Award: Lisa Manley, George Serapag, Payel Dila, Megan Kashner, and Sarah Crawford.
In addition to the prestigious P3 Impact Award, prestigious if we do say so ourselves, based on careful evaluation of our judges, we also offer an Audience Choice Award. Yesterday, Concordia attendees met with representatives of each partnership and attended the final judging presentation. Afterwards, they had the opportunity to vote via the app for the partnership that they thought was most innovative towards addressing a challenge and achieving positive social impact. For the first time ever, our Audience Choice Award is also the same as our P3 Impact Award winner.
The challenges facing our world are complex and in some cases entrenched. However, these partnerships demonstrate that advances in sustainable development, global health, or women's empowerment are possible when public and private sector actors come together to advance shared goals. The Department of State is proud to partner with Concordia and the great UVA Darden School of Business to present this year's P3 Impact Award to a team who is truly showing leadership and delivering results. Please welcome to the stage this year's P3 Impact Award winner. Let's start the drum roll. Let's get it going. Give me a drum roll. I need a drum roll. And the Impact Award winner is the Bioko Island Elimination Project. Let's give a round of applause. Come on up.
Congratulations. 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 Hey, congratulations. Congratulations.
Congratulations. Thank you.
Thanks very much.
Congratulations. Congratulations.
Let me give each one of you guys a coin.
The photo?
Here you go.
Yeah.
Oh, lost the photo opportunity.
Okay.
On behalf of the State Department, we are giving these great doers of good who are making a huge impact on the world, these transformative leaders, a challenge coin from the State Department. Thank you again for your service.
Thank you.
Thank you, sir.
Thank you very much.
Thank you,
Appreciate
sir.
it. Yeah, thanks a lot.
Thank you, sir.
All right, let's go up. You can go. You go ahead.
Yeah. Good morning, everyone. I am Mitoa Ondo Ayekaba, Vice Minister of Health of Equatorial Guinea, which oversees the Bioko Island Malaria Elimination Project.
And I'm Christopher Schwabe, the CEO and President of Medical Care Development, whose international division, MCDI, is responsible for the management of the BMEP project. Also on stage with us are our corporate partners, Pat Sanders, who is the Director of Marathon Oil's Equatorial Guinea program, representing the BMEP's corporate partners here today, and Dr. Stephen Hoffman, who is the CEO and Chief Scientific Officer of Cenaria Incorporated, the US-based biotechnical company working on as part of the BMEP team to introduce their PFS-PZ malaria vaccine to the efforts to eliminate malaria from Bioko Island. We're also really pleased today to have in the audience representatives from our other corporate partners, Noble Energy and Atlantic Methanol Production Company, and our partners from the government of Equatorial Guinea, including the Director of National Content from the Ministry of Mines and Hydrocarbons, and the Director of the National Malaria Control Program in the Ministry of Health, as well as distinguished members of Equatorial Guinea's delegation to the United Nations. And we would especially like to recognize His Excellency Gabriel Obiang Lima, the Minister of Mines and Hydrocarbon, who's not here today with us, but is looking in on these events, without whose strategic vision this whole effort would not have been possible.
We greatly accept the 2019 P3 Impact Award, as well as the 19 P3 Impact Audience Choice Award on behalf of our whole partnership, including our scientific and research partners at the Ifakara Health Institute of Tanzania, the Sweet Tropical and Public Health Institute, Texas A&M University, the Liverpool School of Tropical Medicine, and the London School of Tropical Medicine, and most of our many dedicated staff within the BMEP and the Ministry of Health, and the numerous community of the Bioko Island with whom we engage on a daily basis in seeking to eliminate malaria. We wish to thank the U.S. State Department, Concordia, and the University of Virginia for honoring BMEP and recognizing the work we do. This is truly an important honor. This unique long-term public-private partnership led by the government of Equatorial Guinea has succeeded in bringing together the unique, complementary, and synergetic capabilities of each partner to achieve sustainable health and economic impact at scale. Leveraging this highly successful public-private partnership, we believe that the Bioko experience could serve as the new paradigm for global health, what we call PPP to the power of 2, i.e. public-private partnership that provide a scalable and sustainable framework through which projects become programs, become policy. We wish to extend particular thanks to His Excellency the President Obiang of Equatorial Guinea for his vision and his continued support from the beginning. Thank you again to the U.S. State Department, Concordia, and the University of Virginia for this recognition, and we hope that by sharing this experience through this forum, that the BMEC will inspire further sustainable investment of this nature. Thank you.
Purita Johnson knows what it's like to have a child sick with malaria. On Bioko Island in Equatorial Guinea, nearly every mother does. In 2003, the malaria parasite infected more than 45% of residents. That's when U.S. energy companies joined the battle. They needed healthy workers to develop oil and gas fields near the island.
We had a very aggressive plan to expand it so we'd have a business that will last for at least 20 or 40 years. And by doing that, we became the largest employer on the island. Malaria was clearly the biggest challenge that we would face as an employer, but also the community has been facing.
With their money, long-term outlook, and data gathering skills, energy companies gave Bioko Island something else: hope. Spraying of homes saved lives. So did mosquito nets. Educational programs and community involvement also helped. But for every control measure, the malaria parasite and its mosquito carriers had a counterattack. Without a vaccine to interrupt transmission, malaria wasn't going away. Dr. Stephen Hoffman understands that better than anyone, and he knows the statistics. Malaria kills more than 400,000 people yearly worldwide.
The level of malaria transmission on Bioko Island before the Bioko Island Malaria Control Project went into place was as high as it is anywhere in the world, and much higher than most places in the world. That's the face of malaria to me when I look at those numbers. It's not just numbers, it's the children that I've seen who died of malaria that I couldn't do anything about.
Hoffman founded Scenaria in 2003 to develop a malaria vaccine. Some experts scoffed at his ideas, but in 2007, a vaccine was ready for trial. Results fell far short of expectations. Funding evaporated. Hoffman was convinced the trial protocol, not the vaccine, was the problem. Now he needed funding and a place to conduct a new clinical study. He found both on Bioko Island. Added hope came in 2012. The National Institutes of Health in the US showed Hoffman's vaccine was effective. But would it work in a malaria hotspot like Bioko Island? Testing in 2015 and 2016 showed the vaccine provided protection for at least 14 months.
In this case, Equatorial Guinea has been seen as a country with a big opportunity. A big opportunity to help our own country and our population, yes, but also an opportunity to be able to help all of Africa.
For mothers like Purita Johnson, it can't come soon enough.